What you're about to learn could help you detect diabetes before blood tests, before complications, and before permanent damage begins. Because diabetes doesn't always announce itself with pain. Often, it shows itself quietly, on your skin, your eyes, your hands, your feet, even your face. And millions of people miss these signs every single day because they don't realize they're connected. Some assume it's just aging. Some think it's stress. Others think it's nothing serious. But by the time diabetes is officially diagnosed, damage may already be happening. Today, I'm going to walk you through 7 visible signs of diabetes, signs you can literally see in the mirror or on your body, explained clearly, calmly, and medically. And pay close attention to sign number 4, because that one is frequently ignored, even by people who see their doctor regularly. Before we begin, please subscribe to the channel and like this video. This channel exists to help adults over 50 recognize silent health warnings before they turn into emergencies. And as we go along, I want you to comment below if any of these signs sound familiar, either for you or someone you love. These conversations save lives. Let's begin. What is diabetes? Diabetes is a condition where your body cannot properly regulate blood sugar, glucose. This happens either because your body doesn't produce enough insulin, or your cells no longer respond properly to insulin. Over time, excess sugar in the blood damages blood vessels, nerves, skin, eyes, kidneys, and the heart. And here's the key point most people don't realize. Diabetes often affects the smallest blood vessels first, the ones in your skin, eyes, and extremities. That's why the early signs are often visible, not painful. Now let's talk about them. One of the earliest and most overlooked visible signs of diabetes is darkened, thickened skin. You may notice it on the back of the neck, under the arms, in the groin, around knuckles, elbows, or knees. The skin may look darker than surrounding skin, velvety or thick, slightly raised, dirty, even though it isn't. This condition is called acanthosis nigricans. Why this happens: high insulin levels stimulate skin cells to grow more rapidly, causing pigmentation changes. This is strongly linked to insulin resistance, prediabetes, type 2 diabetes. Many people scrub these areas aggressively, thinking it's poor hygiene. It's not. It's your body signaling metabolic trouble. If you've noticed dark patches that weren't there before, especially on the neck, that deserves medical attention. Unexplained skin itching or dryness, persistent itching, especially on the legs, around the ankles, on the arms or torso, can be a sign of high blood sugar. Why it happens: elevated glucose causes dehydration, reduced circulation, nerve irritation, dry skin that cracks easily. Diabetes also weakens the skin's protective barrier, making itching more intense. If moisturizing no longer helps, and the itching persists, that's a red flag. This isn't just discomfort. It can be an early sign of microvascular damage, slow healing, cuts, bruises, or infections. This is one of the most medically significant visible signs. If you notice small cuts that take weeks to heal, frequent skin infections, redness that lingers, minor injuries becoming serious, your blood sugar may be impairing your body's healing process. Medical explanation: high glucose damages blood vessels, reduces oxygen delivery, weakens immune response. That's why people with undiagnosed diabetes often experience recurrent boils, fungal infections, skin ulcers. If wounds are healing slowly, do not ignore this. Changes in vision, blurring that comes and goes. This is one of the most dangerous early signs, because people adjust to it instead of questioning it. You may notice blurred vision that improves, then worsens, difficulty focusing, trouble reading small print, changes that fluctuate day to day. This isn't just aging. Why this happens? High blood sugar changes the fluid balance in your eyes, affecting the lens. This can cause temporary swelling, shifting focus, early diabetic retinopathy. Vision changes that come and go are particularly suspicious. And here's the danger: waiting too long can lead to permanent vision loss. Swollen feet, ankles, or hands. If you've noticed puffy ankles, tight shoes suddenly, rings fitting differently, sock marks lasting longer than usual, this may be related to diabetes-related circulation issues. What's happening? High blood sugar damages small blood vessels, kidney function, fluid balance systems. This can cause fluid retention and swelling. Swelling alone isn't diagnostic, but combined with other signs, it matters. Skin tags appearing suddenly. Skin tags are common with age, but rapid increases are not. If you've noticed many new skin tags, especially on the neck, chest, or armpits, this may be linked to insulin resistance. Medical studies show a strong correlation between multiple skin tags and metabolic disorders. They are harmless, but what they signal may not be. Redness, shininess, or color changes in the lower legs. This sign is subtle and often missed. Look at your lower legs and feet. Do you see red or brown discoloration, shiny skin, thinning hair, temperature differences. This can indicate poor circulation, a known complication of diabetes. This is especially concerning because reduced circulation increases infection risk, healing becomes slower, nerve damage may follow. Why these signs are missed? Important, most people miss these signs because they appear gradually, they don't cause pain, they're blamed on aging, they're treated separately instead of together. But diabetes doesn't affect one system at a time. It affects everything. What to do if you notice these signs? If you recognize even 2 or 3 of these signs, request a fasting blood glucose test, ask for an A1C test, do not self-diagnose, do not wait months. Early diagnosis can reverse insulin resistance, prevent nerve damage, protect vision and kidneys, extend quality of life. Who is most at risk? Brief, you're at higher risk if you are over 45, have high blood pressure, carry excess weight, have a family history, are physically inactive. But remember, many people diagnosed with diabetes thought they were healthy enough. Quick pause. If this video is helpful, please subscribe. Every week, we break down silent health dangers that most people don't talk about, especially for adults over 50. And comment below, have you noticed any of these signs? Your comment may help someone else recognize theirs. Final summary. Strong retention close. Let's recap the 7 visible signs of diabetes. 1. Darkened skin patches. 2. Persistent itching or dryness. 3. Slow healing cuts. 4. Vision changes. 5. Swelling in feet or hands. 6. Sudden increase in skin tags. 7. Circulation-related skin changes. Seeing them early can change everything. Medical disclaimer. This video is for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. If you suspect diabetes or experience concerning symptoms, seek medical care promptly. Do not delay treatment based on this video.